Ready.
All right, what we're going to do now is give you an exercise program for patients with Osgood-Schlatter's disease. And it's a long name of a problem that people who have it can remember. You might notice that Mandy here, my MA, is a little too old to have Osgood-Schlatter's disease, but we're going to give you the exercise program for that anyway. So, Osgood-Schlatter's disease is inflammation of the tibial tuberosity, which is where the patellar tendon inserts. There is a secondary growth center there that in growing people can become inflamed. They'll have a bump over the tibial tuberosity most of the time, and pain and tenderness in that area. So what we want to do, a lot of times Osgood-Schlatter's disease is improved, or the pain is decreased by improving the flexibility in your legs, particularly the quad muscle, which inserts into the patellar tendon, the tibial tuberosity, and the muscle that fights against the quad, which is your hamstrings. So the first thing we'll do is have Mandy stand up and show us a hamstring stretch. Put your feet right together, and then with your knees straight, bend over and touch your toes. And don't grunt. Now, you can also do this. Now you can stand back up straight, and Mandy's very flexible, so you can use her as an example. Now, if you spread your feet apart a little ways, about 2 or 3 feet, then you can stretch, for instance, your right hamstring by reaching to that leg, and that'll stretch more on the right. You can do the opposite. So you can do them one at a time if you want. You can also do this laying down. If you lay down up here for a second on your back, and you can do a quad stretch by now sit up and grab your foot. And if you grab the one, again, you'll stretch that one more, and this gives you a chance to kind of stretch it and hold if you're flexible enough to do that. Again, as with most stretches, you want to stretch, count to 10 with the stretch, and then relax. If you're doing one at a time, you can do the other side while you're relaxing. Now, stand up, Mandy, and we'll show the quad. The best way, I think, to do the quad stretch is standing. If you'll turn to the side and put one hand here, that's just for balance. And then bend this knee up behind you. Grab that leg. You want to keep your body straight up and down. And then bring your knee backwards, but don't lean forward. And pull your foot up to hit you in the backside. You should feel the stretch right here in your quad. Again, pull, count to 10, relax, and do the other side. With Osgood-Schlatter's, like with most of the exercise programs, you want to use heat beforehand for about 10 minutes, ice afterwards for about 10 minutes. With Osgood-Schlatter's, this in combination with anti-inflammatories will usually take the pain away.